Hi and welcome in my channel. Today, inshallah, we're gonna talk about Latuda. What is Latuda? Chemical characters alternatives in Saudi Arabia, in Egypt, uses side effects, how to minimize side effects, drug-drug interactions, detailed mechanism of action, and we will answer the most frequent asking questions like the best mood stabilizer with Latuda, the initial dose for Latuda, the maximum dose for Latuda, and the best antidepressant with Latuda. So let's go. In the name of Allah, the most gracious, the most merciful, blessing and peace be upon the Master of our souls, Muhammad, peace be upon him. Latuda. What is it, Latuda? Latuda, one of antipsychotics. Exactly atypical antipsychotics. The second generation antipsychotics, which contain active ingredient lorazepam. Lorazepam comes in a lot of concentration like 20 milligram, 40 milligram, 60 milligram, 80 milligram, and 120 milligram. Forms of Latuda. Only film coated tablets, not affecting by stomach acid. So you can use it before meals or after meals, okay? Bioavailability, always bioavailability for brand is better than generics. What about metabolism? It's metabolism of action. It's metabolism of action for Latuda only in liver. So I advise you usually to do intermittent fasting or taking supplements contain milk system like legal one. Okay? What about its excretion? 20% renal and 80% fecal. Okay, let's go to alternatives in Saudi Arabia and alternatives in Egypt. In Egypt, to the Sidon and El Palogan. In Saudi Arabia, no alternatives at all. But take care, in Saudi Arabia, there are different concentrations than any other country in the world. In Saudi Arabia, 18.5, 37, and 74 milligram. Okay, let's go to Latuda uses. Latuda usually used for schizophrenia, and bipolar disorder, especially bipolar 2 disorder. But in Japan, it is used also for bipolar depression. In Japan, only bipolar depression as a monotherapy. Latuda always also used for major depressive disorder, but not alone with other antidepressant. Okay, let's go to side effect. Latuda side effects on CNS like drowsiness, dizziness, and insomnia. For Latuda side effect on GIT, the most famous only constipation. Latuda side effect on libido, not associating with low sexual desire. This is added value for Latuda. Latuda on weight, low risk for gaining weight. So, how to minimize side effect? For insomnia, I advise you always to take it morning time, not at night. Okay. For constipation, I advise you to take fibers. Amazing result for constipations. Okay, let's go to drug interaction. There are a lot of drug interactions with lorazepam, which is the active ingredient in Latuda. So if you are already taking right now any medications, just write it down in comments and I gonna answer you from the highly recommended websites worldwide. Okay, let's go to the most frequent asking questions about Latuda. Number one, the best mood stabilizer with Latuda. The best mood stabilizer with Latuda is lithium, with brand name Apple Lithium, and valproate or valporic acid with brand name is Dibakine. Okay? Question number two, the initial dose for Latuda. The initial dose for bipolar disorder, 20 milligram. The initial dose for schizophrenia is 40 milligram. Okay? The next question, the maximum dose for Latuda. The maximum dose for bipolar disorder is 120 milligram. And the maximum dose for schizophrenia is 160 milligram. 160 milligram. Latuda for schizophrenia, amazing results for schizophrenia which associated with negative symptoms than positive symptoms. Okay, you have to make it in your mind. If you are suffering from schizophrenia with negative symptoms, I advise usually to take Latuda under supervision of your psychiatrist. Okay, it must be psychiatrist, not neurologist, as I'm always talking about. Okay, the detailed mechanism of action of Latuda. What is the detailed mechanism of action? The detailed mechanism of action of Latuda unknown right now, but it is supposed to act on dopamine D2 receptors, mediation for D2 receptors, and antagonist for 5-hydroxytryptamine type 2A. Okay, this is the detailed mechanism of action. What about the family Latuda from the second generation, not the first generation, which called atypical antipsychotics. Atypical antipsychotics. Usually, atypical antipsychotics not associated with extrapyramidal syndrome. Okay. What about its? Is it sedative? Latuda not sedative, but one of the major side effects, as I told you before, is insomnia. So we have to take it morning time. What about its? Can I use Latuda if I am pregnant or lactating woman? There are not enough studies about this point. Okay, not enough studies. The best time, POD, one time only every 24 hours. Morning time. Okay? The last question, the best antidepressant with Latuda or Loracidol. There are 3 antidepressants. Venlafaxine, which comes in brand name Effexor. This venlafaxine, which comes in brand name Bristec, and for tioxetine with brand name Parentelix, and in some countries like USA, Trentelix. That is all for today. If you want to ask any question, just write it down. Bye bye for now.